Hi, I'm Jackie, the Clinical Director here at South Florida Center, and I'm also a registered nurse with over 30 years of experience. In this video, we'll go over everything you need to know to prepare you for your upcoming procedure, from your initial scheduling to the day of surgery, so that you feel informed, confident, and ready. Once you've made your deposit, you'll start by completing a medical questionnaire online to provide us with your health history. After that, our team will schedule your surgery date and begin the pre-op process. One of our registered nurses will then contact you for your pre-operative medical interview, where we will review your medications, past surgeries, and any health conditions to ensure that we are fully prepared for your procedure. It's extremely important that you're honest and thorough during this step. The more accurate your information is, the better prepared your surgeon and anesthesiologist will be to ensure your safety before, during, and after surgery. Safety is our top priority here at the South Florida Center, and your transparency plays a key role in that.
Hi, I'm Laura, one of the medical assistants here. I'll walk you through the blood work process. All patients are required to complete their blood work within 30 days of surgery. If you're a local patient, it's most convenient to come into our facility where our nurses can draw your labs for you. If you're traveling from out of town, you can have your blood work done at any LabCorp location near you. And don't worry, it's included in the cost of your surgery, so there's no additional charge. Your blood work checks many things, for instance, hemoglobin, to make sure your blood count is healthy enough for surgery, white blood cell count, to ensure there's no infection or immune issue, platelet count, to confirm your blood can clot properly after surgery, electrolytes, to make sure you are properly hydrated and have no imbalances. If you're age 50 or older, or if you have any history of heart conditions or other medical concerns, you'll also be required to complete an EKG. This simple test records your heart rhythm and helps us make sure your heart is healthy enough to tolerate anesthesia and surgery. If any additional labs, x-rays, mammograms, or medical clearances are needed based on your medical history, one of our nurses will contact you to explain what's required and will guide you through each step. Timing and pre-op appointments. If you live locally, you can complete your pre-op visit anytime within 30 days before your surgery. For our out-of-town patients, your pre-op is typically done the day before surgery, when you arrive in town. During this appointment, we'll finalize any testing, review your procedure details, and go over all your post-operative instructions. This is also when our medical team will review your surgical plan and answer any last-minute questions or concerns. It's a good idea to bring a list of questions so you don't forget anything important. Here's some pre-surgery instructions. 2 weeks before surgery, you'll need to stop taking aspirin or aspirin-containing products. GLP-1s such as tirzepatide, Ozempic, or Wegovy, diet pills or supplements, vitamin E, fish oils, and herbal supplements. And you should avoid alcohol, smoking, and nicotine in any form for at least 6 weeks before and after surgery. These can all interfere with the healing, increase bleeding risk, or affect anesthesia. The night before your surgery, do not eat or drink anything after midnight. That includes gum, water, candy, and breath mints. Take 2 showers with antimicrobial soap, like Hibiclens or Dial, one the night before and one the morning of surgery. Scrub the surgical areas gently for about 10 minutes each time. Focus on your underarms for breast surgery and the groin area for body procedures. After your shower, do not apply lotion, perfume, powder, hairspray, or deodorant. Please note that Hibiclens should only be used from the neck down.
Hi, I'm Michelle Romero, and I'm gonna walk you through on what to bring and wear on surgery day. Wear loose-fitting, comfortable clothing such as sweatpants, button-up shirts, a robe that opens up in the front. Make sure not to wear any jewelry, makeup, tampons, or contact lenses. Bring a responsible adult with you, someone who can drive you to and from the facility and stay with you overnight. Rideshare services like Uber or Lyft are not allowed unattended. You must have a trusted adult escort you. You can fill your prescriptions on the day of your procedure. For your convenience, there are a Publix, CVS, and Walgreens locations nearby, or you're welcome to use any pharmacy of your choice. If you're traveling from out of town for your procedure, it's very important that you stay locally at least 7 days following your surgery. This allows our medical team to monitor your recovery, perform necessary dressing changes, and ensure your healing is progressing safely. During this time, you'll have 1 day and a 1-week post-op appointments, and will be available should any concerns arise. Staying nearby helps us provide the best care possible and minimize risk during your early recovery phase. The day of surgery, when you arrive, you'll check in, meet me, complete your consent forms, and provide a urine sample for a pregnancy test or nicotine test if applicable. You'll then be taken to a private pre-op room where you'll change into a surgical gowns, have vital signs checked, and your IV will be started. You'll meet with your anesthesiologist, who will review your medical history again and discuss your anesthesia plan. Please be honest about any changes in your health, recent illnesses, or medications that you have taken. Your surgeon will also meet with you to review the final details of your procedure and mark your surgical areas if applicable. Once everything is confirmed, you'll be escorted to the operating room, and that's where the transformation begins.
Hi, my name is Ella. I'm a nurse practitioner here at South Florida Center. After a procedure, you'll wake up in a recovery suite where a registered nurse will monitor you closely as you recover from anesthesia. Most patients remain in recovery for 1 to 2 hours, depending on the type of surgery and how quickly they awaken. Before you leave, your nurse will review your discharge instructions, medications, and how to care for your incisions with your caretaker. You must have a responsible adult with you who could drive you home and stay with you for the first 24 hours. For safety reasons, ride-share services like Uber or Lyft are not permitted alone after surgery. Here's what's normal to expect on day 1. You may feel tired or groggy from anesthesia. Rest and hydration is key. Swelling, bruising, and mild discomfort are common. We'll provide medication to help manage this. You'll live with compression garments or surgical dressings to support healing and reduce swelling. If your procedure involves drains, we'll show you exactly how to care for them at home. Pro tip, keep your head elevated, take medication exactly as prescribed, and avoid bending, lifting, or sudden movements. Immediately after surgery, it's important to avoid prolonged bed rest. Take short, gentle walks every few hours while you're awake to help promote circulation, reduce swelling, and lower your risk of blood clots. Your first post-operative visit will take place the day after your surgery, unless your procedure is on a Friday, in which case your visit will be scheduled on a Monday. During this appointment, we'll check your incisions, change your dressings, and ensure everything is healing as expected. Additional visits will be planned based on your specific procedure and recovery progress. Remember, healing is a gradual process. You'll notice continued improvements in swelling, contour, and overall results over the next several weeks and months. As for your sutures, dissolvable versus permanent. Depending on your procedure, your surgeon may use absorbable or permanent sutures. Absorbable sutures will naturally break down and absorb into your body over the next several weeks to months. There's no need to have them removed. Permanent sutures, on the other hand, will need to be removed in office at one of your follow-up visits. Your nurse or surgeon will let you know which type you have and when to return for suture removal if needed. Keeping your incision areas clean and following your post-op instructions carefully is key to minimizing scarring and preventing infection.
Hi, I'm Tamika, and I'm going to walk you through the signs of infections and complications. It's normal to have some swelling, bruising, and mild discomfort after surgery, but there are certain symptoms you should watch for. Call our office immediately if you notice redness and swelling that's spreading or worsening, drainage with a foul odor, fever over 101, severe or worsening pain not relieved by medication. If you experience chest pain, difficulty breathing, or severe leg pain, or swelling after surgery, this could be signs of a blood clot. Call 911 or go to the nearest emergency room immediately. For questions after hours, we have a dedicated post-op line available 24/7 at 954-258-7528. You will always be able to reach one of our post-op nurses for guidance. Healing stages. Week 1, early healing stage. By the end of your first week, most patients notice gradual improvement. You'll return for your 1-week post-op visit for incisions check, drainage removal if needed, and an overall progress evaluation. Swelling and bruising should start to decrease. Many patients transition from prescription pain medication to over-the-counter Tylenol. Gentle walking every few hours while you're awake is highly encouraged to boost circulation, reduce swelling, and help prevent blood clots. Focus on rest, hydration, and proper nutrition. This early healing stage sets the foundation for your recovery. Around the 1-month mark, you will start seeing real progress. Swelling continues to go down and results will become more defined. Most patients return to work and resume light exercise. Incisions may appear slightly pink or firm, but this will improve with time and proper scar care. At this stage, we'll assess your healing and guide you on when to increase your activity level. You'll likely be cleared to resume more vigorous exercise and physical activity at 6 weeks.
Hi, I'm Dr. Rohan Polichirla, a plastic surgeon here at the South Florida Center for Cosmetic Surgery. I'm going to be talking you through some of the milestones to expect from 3 to 6 months. By 3 months, most of your swelling will have resolved and you'll see a much clearer picture of your results. Any firmness near the incision sites will continue to soften. Many patients feel confident wearing fitting clothing and fully enjoying their new contours. At around 6 months, most patients are fully healed and enjoying their final results. Their scars have softened and lightened significantly. Swelling is completely resolved, and whether you had liposuction, breast surgery, or facial rejuvenation, your transformation should now be visible. Just keep in mind that for rhinoplasty patients, that final refinement, especially at the nasal tip, can take 1 to 2 years. Now let's talk about some healing tips. To support your recovery, it's essential to avoid smoking and all nicotine products for at least 6 weeks before and after surgery. Nicotine restricts blood flow and significantly increases the risk of poor healing, open wounds, and infection. You'll also need to wear your compression garment as directed to reduce swelling, support your new shape, and promote proper healing. This garment plays a key role in contouring and comfort during recovery. And then, once you're ready to transition, we offer second stage garments for purchase right here in our office. When your incisions have fully closed, typically between 3 and 4 weeks after surgery, you can begin using scar gel to support smoother, softer healing. Medical grade scar gel is also available for purchase right here in our office. As for recovery IV therapy, we're proud to offer that right here in our office as well. It's one of our most popular post-surgery options. Each IV is carefully formulated with fluids, vitamins, and minerals designed to rehydrate your body, boost energy, support your immune system, and promote faster healing. Many of our patients share that they feel noticeably more refreshed, experience less swelling, and recover with greater ease after their treatment. It's a great way to give your body the extra support it needs during recovery. Ask our team about adding a recovery IV to your post-op care plan. We know recovery can feel overwhelming at first, but you're not doing it alone. Our entire team is here to guide and support you every step of the way. Be patient with your body. Healing takes time, but the results are worth it. Thank you for trusting us with your care.